Hello friends, my name is Isaac and today I'm performing skill video on intravenous fluid and med administration. So before I start, I got orders and I did pre-work to do this thing, and what I'm going to do is that I'm hanging up the fluids and I'm just hanging up the medication, that is amoxicillin. So I did the pre-work that I have to hang up like 150 ml over 60 minutes, and my drop factor is 15 drops per minute. So work shows that I'll be giving 38 drops per minute. So in meds, same 15 drops per minute. I have to hang 100 ml over 15 minutes. So work shows that I have to give 100 drops per minute. So let's start. So before starting, I'll be washing my hands and just putting on my gloves. So before starting, I'll be just looking into my physician orders, and I'll be just doing with the 6 rights of the medication, that is right patient, right med, right dose, right route, right time, and right documentation. And I'll be just, before hanging, I'll be just having 2 identifiers, like for ask for patient name, date of birth, that will be my 2 identifiers, and I'll be asking the allergies if my patient have any kind of allergies. I will confirm that too, and then I will confirm with my chart as well. So okay, let's start that. Before we start, I'm just going to introduce my IV things. That I have 2 IV tubes. First I have primary tube, which is saying 15 drops per minute, what we are using. This is my secondary tube for meds. This is also showing the 15 drops per minute. Now I'm going to explain different parts of my IV tubing. So first, starting with my spike that is on the top area, and that is covered, and I will keep it stirred and covered until I put that into the bag, the fluid bag. Here is my chamber. I'll be just filling it halfway, and where I'll be just looking the drops coming in here, and that the air bubbles will be coming up. That will be showing that is there any air that is coming in, not going into the patient IV. So I got the roller clamp. This is all the way down. This is locked right now, so nothing will be going out. So if I just move it upwards, like if I'm opening, that will be just giving a lot of med going on. So I will be adjusting this thing while I'm just giving my meds to my patient. So I'll be doing that, and then I'm just moving forward. This is my whiteboard where that will be using for putting my push medications, and I'll be using this for my piggy bag. That's amoxicillin. I'll be putting my other IV here, and this is my adapter. This will be just going on in my patient's IV. Same, I got another set of IV. So same thing. I got spike still, that is covered. Want to make sure that is sterile. Same, the drip chamber, which I will be filling it half the way, and that will be just, and then I'll be just counting the drops. I'll be looking here. Same again, roller clamp that is closed right now. I'll be adjusting while I'll be doing the stuff, and here's come the adapter, and this adapter that will be going in my whiteboard I was just telling before. All right, let's start the thing. So here's my first bag. I'm just going to choose. So before starting, I will take off the cap of my fluids and just putting down, and then I'll be just taking off the spike and just pushing it all the way to the end. So, and make sure before that my roller clamp is off. Other than that, my all med will flow out. So let's hang. There's my first bag, that is my fluids. And now I had put that on, so I'll be just priming my all IV, so there should be no air. That is the safety thing I'm doing to save my patient. I don't want to just give him any kind of air, so I'll be just priming my tube. The reason for priming is to just clear. So I'll be just opening up the roller clamp slowly. I'll be doing slowly. If I'm going to just put my roller clamp fast, it will be just giving a lot of med. That is the wastage. I don't want to waste the medication, so I'll be just putting on. So before then, and here I will be just filling, I had said halfway, so I'll just fill the halfway, and now I'm just opening it. So just priming this. So I make sure, see, the bubbles are going in, so I don't want these bubbles to be in, so that is the main reason I'm just priming my tube. So my tube is primed, so now I'll be just counting like how many drops I was supposed to give. That was 38 drops per minute. So I'll be counting on 38 drops. From now I'll be just counting whole 1 minute. So I'm just opening up again. I had just take off adapter's put. So as I said, I'm just going slowly. So because I have to count like 38 drops, so I'll be counting whole 1 minute. Just I'm closing this out. So I counted like 38 drops per minute. Here I want to just remind one thing. When I'm hanging my IV, I will be making sure that they are 30 inch above from my patient's IV, like their IV cannula. So that should be 30 inches higher than that. So now I'm just moving my repair, just adjusting here. So that is done. So I'm just going towards my medications. Same thing, I got amoxicillin, so I'm just again taking cover off and then taking my spike cover off and then putting it all the way in. So one thing that I want to just say, that always your secondary tube will be the small tube. So that will be the big thing, and other big thing is that they will be having no whiteboard. So just they will be having like spike, chamber, roller clamp and adapter. So I'm just hanging my meds, that's amoxicillin. I'm just hanging it a little bit up because it's gonna give like 100 drops. It will be faster, so as it's up it will be going fast, and that's the lower one that's giving 38 drops. Now what I have to do is that I'll be just taking here's my whiteboard where I'm going to put my medication. So I'll be just cleaning my whiteboard first with alcohol swipe, and then I'm just pushing my adapter all the way here. So now I had did this, so it's time to prime my medication. So I'll be just going up slowly first, and before that I'll be just filling half the way, and then I'm just priming my tube. Making sure that there's no bubble in it, because for patient safety, which is my concern. So my tube is primed. So here I'm just going to count whole 1 minute, as I have to give 100 drops. So I'm just counting for whole 1 minute. And before just doing 100 drops, I'll be just opening up my regular IV. So that is 38 drops, and now I'm making sure that that is 100 ml just going on in it. As I had counted like whole 1 minute. So here's whole 1 minute. I just did that. I'm just putting this in my patient. So I have just put this medication in my patient. That I'm showing that it's done. So one thing, just before starting, before priming my secondary tube, I'll be just holding for a minute my like fluids, so that will be just not having any kind of just mixing the things, like it will be safe. So once I'll be doing like priming my secondary tube, then I'll be just opening up my fluids, and then I'll be just priming. I will be just doing my drop factor, like 100 ml I have to give. I will be just counting on whole 1 minute. That's what I was just trying to explain. And now my patient is just on IV. I'm just making sure that there's no infiltration, or IV is safe. My patient is feeling okay, and the things are just he's just getting the right medication right in time. So what I'll be doing, I'm just taking off my gloves. just washing up my hands and just making sure that my patient is in comfortable position, call light is near the reach, and I will be just documenting what I have did. Thank you so much. You have a good day.